Take a moment to envision your life 20, 30, 40, or even 50 years from now. Think about the people you care about and how they might be caring for you. Or think about your parents or grandparents. Are they living a life that they enjoy? Could we be doing better? Do you wish for a better outcome for yourself? Hi, I'm Anna Chodos, a geriatrician and internist focused on dementia care. While there's currently no cure for most of the diseases that cause dementia, there are many things that we, as clinicians, can do to improve a patient's quality of life. But it all starts with a diagnosis. By now, you should recognize what normal versus abnormal cognition looks like. You should also understand that acquired cognitive decline that is severe enough to cause functional decline is the hallmark of the syndrome of dementia. As a reminder, we have links to a number of tests on our website that you can use to screen for cognitive and functional decline. We've also shared a list of helpful statements that you might use to bring up the topic of screening with your patients. The more we normalize screening for dementia, the more people we can help. Remember, a positive screen doesn't mean there's a diagnosis, just that we need to proceed with more of an evaluation. And when there is a need to test further, you should feel confident that by working through these three components, history and exam, objective data, and a review of comorbidities that may be affecting their cognition, you will be able to make a dementia diagnosis. You have the tools. We want to remind you again of the many different screens and tests that are available to you on our website, and that you can adapt and modify them to suit you and your practice. Remember, the most important thing we can do is establish a baseline as early as possible. We know that as you continue your journey, you will feel more assured in detecting, diagnosing, and managing dementia care. We hope that our framework for starting a care plan helps you feel confident that once you deliver a diagnosis, you and your patient have a path forward, one in which everyone feels supported. We also know that disclosing this diagnosis is difficult, so we hope that our lesson on discussing dementia provides some useful tips and language that can help you communicate effectively and compassionately. Remember to create space for questions and check in with your patient and caregiver often. And we really hope that you now understand the importance of including and supporting caregivers as early as possible, not just because they're foundational to your patient's well-being, but also because they can provide collateral information instrumental in establishing a diagnosis. And lastly, you should be familiar with what kinds of behaviors you might expect from someone with dementia, and you should understand how to help caregivers manage those. We want to thank you for the critical work that you do and for taking the time to learn how to better identify and address the needs of people with dementia and those of their caregivers. For all the toolkits, resources, and other videos from this series, please visit our website.